So, hello from Qunomedical headquarters from Berlin. I'm Dr. Gökay Bilgin. I'm a hair transplant surgeon in Smile Hair Clinic, and I have been doing hair transplant for 9 years.
Okay, and I'm Dr. Mehmet Erdogan. I'm also in Smile Hair Clinic and working for a hair transplantation field as a hair transplant surgeon for 8 years. So we are very glad to be here because we are doing a medical thing. We are not selling something, or we are just providing a best treatment for the patients. So it happens with the experience. We have the experience, Qunomedical has the experience on the case manager side, because you are talking with the patients before you are knowing their expectations. You are forwarding them to us. We do the treatments, and we have on our part experience. So the experience is important when we share it. So we are doing today here with the presentation, also with the interview, to share our experiences to the patients that will be the future patients or the existing, pre-existing patients.
What should you know before booking a hair transplant is hair transplant is a dirty market. There are lots of clinics on the market and they are promising patients fairy tales that they can never have. So what the patient should do is find reliable experts like Qunomedical that will guide them through their booking. And they will make them to meet with trustworthy clinics that will handle which will handle their transplantation seriously.
So I think they just start with giving the decision. So if they are just giving the decision to go somewhere, they should ask the doctors of the clinics through you if they are eligible for a hair transplantation. Or without hair transplantation, non-surgical options could be also available for them. So we may consider that, for example, because we are postponing our things to do. If the hair loss started, maybe we can stop it at that time with PRP, with some products using, and eventually after that you can go for hair transplantation, but they should ask to us about what to do first. Does age play a role? I don't think, because it's a aesthetical thing. It's not like a disease or a sickness. So when patient has to check to see his self-esteem and want a good result from 20 years old to 60 years old, they can have it anytime, but sometimes they have some different informations, like they should wait until the all hairs is receding. No, I don't think it's right. First, they should stop it by going to an expert, taking the expert's information, taking opinion. So we can do some different things, maybe to stop his hair loss, and maybe then we can do the operation. Yes, how long does the procedure take? It's according to the patient's graft number, cooperation, underlying diseases, or the things that is happening during this surgery. Sometimes they are not so comfortable, so it delays our operational times, but usually after we start the operation it takes up to 6-7 hours according to graft numbers.
And actually it's not painful at all. They feel a little bit pain only during the local anesthesia, and after that there's no pain. All of our patients say, okay, I had a little bit pain, I was afraid that it would be painful, but I didn't feel anything, and I'm so comfortable.
Yeah, actually, if we really carefully doing the local anesthesia, it really lessens the pain, even with the high pain threshold patients. Okay, why some grafts are not take or grow is sometimes it's a bit misplaced. So during harvesting, after the extraction, we just collect those hairs, and sometimes the technician who just collects it could harm and give a traumatic thing to the graft itself, or sometimes even in the implantation part. So those things lead hairs not to grow. That's why we should be very careful by implanting and by collecting parts, and also the direction of the canals, the incisions, and implantation will be very good to grow.
Also, if they are not preserved in ideal circumstances until they are implanted, that's another reason.
Okay, so why does regrowth differ from patient to patient? Is when we extract the hairs, they are not synchronized. So they are in different levels of the growing, resting phases. So in some patients, the extracted grafts could be more in the growing phase, so it grows very, very quickly. But it doesn't mean that it happens in every patient. So it could be different from patient to patient, like everything.
How long do I have to wait before heavy exercise after hair transplant? The answer is actually about 1 month, because we are afraid of excessive sweating, maybe a place for bacteria to reproduce, and they may cause an infection. So to avoid that, we highly recommend them to wait 1 month before they start heavy exercises again. What happens to the donor area? Actually, if it's done properly, it will not be visible. It will not be so obvious that a patient had a hair transplant, because in the end, the donor area loses a little bit density. Okay. But as I said, if it's done properly, it will not be obvious that they had a hair transplant. But if it's not done properly, there may be some scar cases, and it will not look nice, and even patients may feel very bad that they had a hair transplant. They may feel pity that they have hair transplant. So to avoid that, they need to find an experienced team for hair transplantation.
And I think the patients should know one more thing. When we extract the grafts from the donor area, it doesn't grow again. So patients think that they are growing in their donor area, but actually it's not. So they think, okay, you get the hair, you get the follicle unit from there, so what happens to there is like Gökay answered, we just leave some hairs there for a better appearance. And also we don't extract too close to each other, not to create more scars, more holes, because the holes that we created already are very small and body can heal it very quickly. But if it's larger, it creates with the scar tissue, which we don't want and which doesn't appear good after. So, you can answer it.
No, yes.
Okay, so how long and how does it take to grow? So first, after the operation, it's like a honeymoon period. It's growing well at the first 15 days. It grows and the patient is happy at that time. But after that, we see the shock loss period, which takes 3-4 months, and probably most of the patients are very disappointed at that time. Even we are telling this, or even they are watching in this thing, they know it, but at that time, surroundings, family,
they have
friends,
doubts. They have doubts about the result.
Yeah, it's the most disappointed part because it's a long time. It's not a few days, few weeks. It's a long time. So they started questioning again and again. But we don't expect any growth up to 4th month. So after 4th, sometimes 5th, it is not like a calendar, it's not like a standard times, sometimes 3, sometimes 4, sometimes 5, but after that time we see the growth up to 40-50%. So it means that at 6 months we see 40-50% of the result that we're gonna see in the end. And 12, maybe it's up to 70-80, and up to 18-24 months we see the full result.
How long will I have pain after the procedure? Actually, donor zone heals in 5 or 6 days. So after that, we don't expect pain. But in some cases, because of the dry skin and the regeneration of nerves, they may feel pain a little bit. Then we advise them a cream with steroids. It's like a flashlight in the night, so immediately it stops pain in 1 or 2 days and they feel comfortable. About the recipient zone, actually they don't feel any pain after the transplantation. Even we give them a painkiller, most of them say they didn't need it and they want to give it back.
So how soon after the first transplant can patients take the other session? It's according to the planning. So sometimes we plan with some patients about the frontal area implantation at first, and we leave the second part for the second session. So in these cases, if we don't implant in the crown area, for example, after 6 months when the donor area is healed, we can still extract, we do the extraction. But we mostly, because of the circulation, we mostly do not do that. We just distribute all the hairs and spread crown, mid-skull, frontal, and we want to see the progress. After a year, probably, when we see most of the result, we say patient to talk again at that time to see the progress, and we do the another. We plan for the second operation.